In this commercial, I'll be talking about the medication Digoxin. Indications. Its pharmacologic class is cardiac glycoside, and therapeutic class is antiarrhythmics and inotropics. As for indications, it is indicated in heart failure, atrial fibrillation, and atrial flutter, and paroxysmal atrial tachycardia. Its action is to increase contractility or strength of myocardial contraction. Adverse effects. The most dangerous adverse effects is the ability to create dysrhythmia in patients who have hypokalemia or impaired renal function. Also, nausea, vomiting, fatigue, anorexia, and visual disturbances, for example, seeing halos, a yellow-green tinge, or blurring. Contraindications and precautions. It is contraindicated in hypersensitivity, uncontrolled ventricular arrhythmias, AV block, idiopathic hypertrophic subaortic stenosis, constrictive pericarditis, and known alcohol intolerance. Use cautiously in hypokalemia, hypercalcemia, hypomagnesemia, diuretic use, hypothyroidism, myocardial infarction, renal impairment, obesity, and for geriatrics, they are very sensitive to toxic effects. Dose adjustments required for age-related, decrease in renal function and body weight. For OB, although safety has not been established, it has been used without adverse effects on the fetus. Interactions. Some drug-drug interactions include thiazide and loop diuretics, piperacillin, ticarcillin, amphotericin B, corticosteroids, and excessive use of laxative may cause hypokalemia. Beta blockers and other antiarrhythmics may cause additive bradycardia. Natural products include licorice, and stimulant natural products like aloe may increase the risk of potassium depletion. St. John's wort may decrease levels and effects of digoxin. Administration. For IV push administration, it may be administered undiluted. May also dilute 1 ml of digoxin in 4 ml of sterile water for injection, D5W or 0.9% NaCl. Less diluent will cause precipitation. Use diluted solutions immediately. As for rate, administer over at least 5 minutes. Nursing interventions. Take epoproc pulse for 1 full minute. Note rate, rhythm, and quality before administering. If pulse is below parameter established by a healthcare provider, usually 60 beats per minute, withhold and notify provider. Check recent serum digoxin level before administering. If level is higher than parameter established by the healthcare provider, usually 1.8 ng per ml, withhold and notify provider. Also monitor the ECG throughout IV administration. Patient education. You want to review the signs and symptoms of digoxin toxicity, such as abdominal pain, anorexia, nausea, vomiting, visual disturbances, bradycardia, and other arrhythmias. You want them to know to notify the provider immediately as soon as these symptoms appear. Also, avoid taking antacids and antidiarrheals within 2 hours of digoxin administration. This commercial was brought to you by Nurse Christy.